Alright, so my name is Salisa Hahn, and I documented the fatigue effects with an EMG for muscle recruitment during prolonged isometric contraction. So, a little bit of background, this hand grip dynamometer is awesome for showing muscle recruitment and activation levels. It kind of helps determine the strength and whether or not a person has injury or needs to improve in that area. And it's really easy to use, no experience required. So it's really easy to use with all the different kinds of patients. So basically my question was, can subjects perform a prolonged isometric contraction that is a submaximal level over a continued time period? And what I thought we would find is basically that they would have a greater amplitude, and there should be an overall positive increase in recruitment because you're trying to continue that contraction over that long period of time. We had 8 subjects that were first-year DPT program students, 75 of which were males, and they were young, healthy, active individuals, so we can't really apply that to many populations, but there was an exclusion criteria of they didn't have any latex allergies or anything like that. So we went ahead and put the electrodes on the extensor and flexor muscle bellies of the wrist, and then grounded that on the biceps brachii muscle belly, and then had them contract as much as they could, as hard as they can, and calculated 25% of that. And they went ahead and repeated that for, while we recorded, for 15 seconds intervals for as long as they can, or up to 300 seconds. And we went ahead and found the mean and percent standard deviations, and basically across the board for flexors, extensors for each subject at each time interval. And basically what we ended up finding is that there was an overall decrease in the activation of muscle, which is kind of contrary to what we were expecting or what we should have found. So that kind of created some problems. We should have seen an overall increase in that trend line, which basically would mean that we're trying to recruit more muscles in order to continue the isometric contraction for that long period of time. But basically, for the clinical relevance, this is actually really important because PTs can help determine whether or not a patient has problems in that area, can kind of start to create a baseline of where they need to start treatment or the plan. And it's really easy to do. It's inexpensive if you already have the EMG. It's pretty basic and rudimentary. So that's pretty much my poster. Thank you so much.